Great, thank you guys so much. So I'm Colleen Nielsen. I'm the Director of Lake County Public Health, as most of you know. Thank you so much for being with us tonight. I know that Lisa is actually working and being here, so I want to honor her time because we do have a slideshow presentation that we would like to share, and I'd like to have her be able to do that first, and then we can kind of go from there.
Colleen, just to be sure, you're talking about the vaccine slideshow?
Yes.
All right.
So we'll kind of start off with vaccines because it's kind of been at the forefront of everyone's minds. And so just want to kind of show you where we're at, and then I can update you on the public health side. Like I said, I just want to make sure that Lisa has time to go through these and we can answer questions and kind of go from there. Thank you.
Great. Can everybody see my screen okay? All right, so I wanted to start with a short video that talks about the vaccine that we're anticipating here to arrive within the next 2 weeks. It's the Moderna vaccine, but the specifics of the new technology that was developed to make this vaccine. And then I'll go over in detail all of the explanations of what the video goes over. So here we go.
It all started with isolation of the virus from an infected patient in China. The coronavirus was sequenced and its genetic information was uploaded to a public database. Working together, scientists at the NIH and Moderna identified the sequence for a key protein on the surface of the virus called the spike protein as a good vaccine candidate. The instructions for making the spike protein were then encoded into an instruction molecule called mRNA, which could be administered directly to patients as a vaccine. The vaccine is injected just like other vaccines. The mRNA is taken to immune cells where it instructs cells to make copies of the spike protein as if the cells had been infected by the coronavirus. Other immune cells, shown here as red and orange figures, are then able to learn about the spike protein and develop ways to protect the person if they ever come into contact with the actual coronavirus. What makes this approach different is that you don't need to make the virus itself to make a vaccine, a time-consuming and intensive process. Instead, you use the information from the virus and administer the information directly to the patient. Essentially, the patient makes their own vaccine. This cuts out the middleman. Using this approach, NIH and Moderna were able to go from sequence to a vaccine ready for human testing in record time, just 42 days.
Great. So specifically, how does the vaccine work? So what's interesting about this vaccine is it was made with new technology, and it's not been used in vaccine production in the past. In the past, we have used parts of the virus or the virus itself, inactivated it by mixing it with a chemical, and then used that directly as the vaccine. And in the past, there have been some instances where the vaccine can then cause infection. So if you look at this particular vaccine, it is only using a piece of messenger RNA, so a very small piece of genetic material that was isolated from the coronavirus to make the vaccine. So there is absolutely no way that you can get COVID-19 from this particular vaccine. The Lake County Public Health Department, it will be coordinating our vaccine efforts for us here in Lake County. And as we begin vaccinations here in the next 2 weeks, the Lake County Public Health Department will be doing all of the vaccinations. It's injected just like every other vaccine that you've ever had. There is a 2-dose series, and so you get one, and then 28 days later, you get the second one. And then the most important thing to remember is that it uses your body's own immune system that allows you to make your own immune response to the vaccine. The big question that we've all talked about is safety. How do we know that the vaccine is safe? And it's very, very important to remember that we can make vaccines quickly. Every year there is a new flu vaccine. And so every year, in a matter of about 10 months, a new flu vaccine has been manufactured. And, obviously that's been happening for decades now. And so if you look at this particular vaccine, it was made in about 9 to 10 months, which is, something that we've been doing for decades. The technology that came out of this vaccine is new technology, but it was tested the exact same way every vaccine that has ever been manufactured and used in the United States in the past 20 years. It has gone through the same process. So phase 1 is when they give the vaccine to 20 to 100 people. In the Moderna case, it was 100 people, and it just looks at safety data. When those 100 people were given the vaccine, did they have any side effects? The answer was no, there were no significant side effects. Phase 2 is that it is given to several hundred people, and then they measure response to the vaccine. So is it working or is it not? Phase 3 are tens of thousands of volunteers. And so for the Moderna vaccine, it was somewhere between 30 to 40,000 people got this vaccine. And that's where they look at safety. Did anybody have bad side effects? Did anybody's hair turn purple? What happened at the end of the vaccine? And the safety data for this vaccine, because it does not contain any live portions of the virus, it doesn't cause any evidence of illness. And so the vaccine was found to be very, very safe. And then hopefully what happens tomorrow for the Moderna vaccine is that the Food and Drug Administration then approves the vaccine to be distributed. So the safety steps that are done for every single vaccine that has been approved in the past 20 years is the same. So there were no corners that were cut. There was nothing that was done any faster than it needed to be. It was all done in a very precise, stepwise fashion. So this is just a summary of the graph. All 3 studies, phase 3, all 3 phases of the study were done doing data safety and monitoring boards. There were people from all over the world watching the safety data. There were, of course, people from Moderna, the company, but there were more people outside of the company looking at the safety data and making sure that everything was up to par. And so this vaccine has been found very, very safe. What to expect after you're vaccinated? So vaccines are designed to trick your body into thinking that you've been infected. So you're supposed to have a reaction to the vaccine. You're supposed to have some pain at the injection site. You're supposed to have body aches, some joint aches, maybe even a low-grade fever, but it's very short-lived. It's only for a day or two. If you don't have a reaction to the vaccine, then I worry a little bit about your immune system and why it's not as aggressive as it should be. But everybody knows when you get your flu vaccination, your arm hurts. You also feel, a little achy for 24 hours, but it goes away very, very quickly. And that is just, what's supposed to happen when you get a vaccine. If you look at the process of building an immune response, this immune response was phenomenal. The effectiveness of this vaccine is one of the best we've ever seen. The MMR vaccine, interestingly enough, had the same efficacy, but 94.5% efficacy. If you look at the flu shot over, most years, it's somewhere about 50% or so. So this one is nearly twice what that is. When you get your booster, that's when you enjoy the entire, 94.5%. After you get one vaccination, it's thought that it's, about half of what that is. So you will experience, discomfort as well when you get your booster. So please expect that and know that we expect that, and that's what's supposed to happen. When you get your booster, so 4 weeks after the first vaccination, it still does take a couple of weeks until your body, enjoys that full immunity. If we do not have enough folks in our community to be vaccinated, then the pandemic goes on. And what we're trying to to accomplish here is our herd immunity. When there are enough folks, in the world who have been exposed to this, either wild type virus or the vaccine, 70% of us have to have either been vaccinated or have had the virus in order to make sure that our community is safe. And so if people don't get vaccinated, unfortunately, we have to continue to wear our masks and worry about the status of the pandemic, likely for years. And I don't know about all of you, but I am very excited to not have to wear a mask all the time, to have a party, to get together with my family. And the only way that we're going to be able to do that is to be vaccinated. So it is enormously important that when this vaccine rolls out over the next 6 months to all of us, that we line up and we get the vaccine so that we can finally say the end, goodbye to the end of this pandemic. In summary, the vaccine is safe. The vaccine is very effective, and the vaccine will end the pandemic if we all get vaccinated. And I know that's something that each and every one of us wants. I'll let Colleen talk about the Lake County's vaccination plan. And I imagine that we'll wait for questions, but certainly let me know how you'd like to proceed.
Thank you, Lisa. Next slide, please.
Oops, sorry.
Yeah, thank you. Thank you so much. So some of you might have seen this slide already. It was presented to the general public from the governor's office. When we initially are looking at our vaccine, there have been priority groups set. That's come down from the CDC, and then the state has been looking at that and has really been looking to accept that. When we first received this was kind of in a color graphic, but I think for folks to really understand I don't care about the colors, I just want to know when I go. The state broke it out this way, which I think is a much easier way to kind of look at it. So phase 1 includes our highest risk healthcare workers and individuals, as well as our moderate risk healthcare workers and responders. So when you think about that, that's our hospital staff, that's our Rocky Mountain Family Practice staff, getting into the 1B, that's our firefighters, our sheriff, our police, and some of our other essential folks, for example, like public works. Like if we have someone who needs to get out of town in an ambulance, we need that person to be healthy to be able to drive a plow to make sure that our roads are open to get people to where they need to be. So when we think of that, per what Lisa shared earlier, the Moderna vaccine should be approved tomorrow. It should be coming into Lake County in the next 2 weeks. We've been working behind the scenes with all of the groups, if you will, that fall into that first phase 1 to know how many numbers we have, to figure out who's going first. And once the vaccine comes in, to be able to vaccinate all of these people very quickly. So we are working with all of those agencies, and we continue to identify groups. So that's going to happen first. One of the good things about being small, if you will, compared to some of the metro area, is initially we know that we're going to receive 100 doses. So even with that, that does not cover everyone in phase 1. We already are prioritizing, once again, who that first 100 doses would go to. And depending on the supply chain, if we were to get doses every week for 100, we could be through phase 1 much quicker, as you can imagine, than think the Front Range. We have heard that if we do have vaccine available, we have the ability to then move on to phase 2. And this is where I think more folks are interested, because of the fact that this is a little bit more geared to our high-risk populations, as well as people age 65 or older, people who have like front-facing jobs with the public who interact directly. And so some examples they talk about are grocery workers and school staff, people who work in high-density settings like farms and meatpacking plants, workers serving people that live in high density settings. So when you think about, and that's not necessarily here, but they really talk about like congregate settings in schools and colleges and places where folks don't really have an option. They are living like in a dorm, if you will. So those are just some of the folks that will be vaccinated in the spring. So like I said, depending on the flow of vaccine and what we receive is how quickly we can move through these phases, as well as the fact that we will not start a new phase until we feel confident that we've given everyone who's eligible in their phase an opportunity to come in. We'll give plenty of notice and we'll put it out in many different fashions. So if there's a way that you want to know, in the sense of we're not taking names, we're not taking any of that kind of information, because we don't want to have a list where someone has an expectation of, oh, I put my name on the list and now I don't have to do anything else. I want everyone to be proactive and we'll share out that information. So we usually do that through the newspaper, through social media. We do a community briefing, email every week. So if there's something that we're missing that you think we should be providing information, please feel free to drop that into the chat. We obviously will be using all of our partner agencies to push out messaging through their partners as well. So once we get through phase 2, which is spring, we're looking at early summer for phase 3. And this is the general public. So basically anyone we did not capture in phase 1 or phase 2, we'll do in phase 3. Some of you might remember that we did a drive-through clinic for flu shots in November. Very successful. We were able to vaccinate 191 people in a very short amount of time. It allowed our staff as well as volunteers to understand the process, that when we get to this phase 3, that's probably the best way to do it, in the sense of we don't have to worry about screening as particular, in the sense of it's open at this point to everyone. And we'll do more of what we call a point of dispensing, a pod, at that point in time. And like I said, the good news is that we practiced it. We feel confident. My staff is ready to go. With all of the uncertainties of COVID, this is where I feel that we can really shine, in the sense of this is what we do. Public health does vaccines. So this is not daunting to us. This is, we're thankful to have a little bit of light, because it's been very challenging, as you all know, to get everyone on the same page at the same amount of time. So once again, this is our vaccination timeline. It's a little bit easier to see broken out. And that's kind of where we're at as far as that goes. Thank you, Lisa. And then we do have vaccination info resources, and we'll push all of this information out. This will be shared. And we do have, as you can see on, if you even go to our county website or our website with our Office of Emergency Management, all of this information is there as well to link out. So I think this is a good time to take any questions that folks might have kind of around that vaccine piece, timeline, why we still have Lisa here. I just know that she could be snatched away from us at any moment. So we are open and ready.
You are welcome to put your questions in the chat. You're also welcome to unmute yourself, *6 if you've called in and are on the phone, or go ahead and unmute yourself through Zoom, and we can just field questions that way.
Dr. Zwerdlinger, this is Mayor Lobby. I'd just like to ask you, and this is just a curiosity question. I don't know how much it might apply. How about people who are immunocompromised or maybe in chemotherapy, things like that? Will this vaccine work for them?
Yeah, that's a great question. So any vaccine is dependent upon a healthy immune system. And you have to be able to mount an immune response to the vaccine. And so if your immune system is compromised because you're taking chemotherapy for cancer, then it won't be as effective. That's true for any vaccine. We still recommend vaccines because any immune response is better than none. But yes, you're correct, sir, that it won't be as vigorous as it would be in someone who's otherwise healthy.
I had a question. So for in phase 2, where it said So 65 and older, and then underneath that was people that, might have lung disease or obesity, diabetes. Are you guys compiling lists right now through the doctor's offices and stuff of those people, or how will you know what people get that, or they go to you and tell you that they have a problem?
Great question. So we are not compiling a list, so to speak, but the conversation that's happening about phase 2 is really being mindful of who is eligible for that group. And so that conversation is ongoing, but initially we will rely on providers who already treat people and are aware. So right now for phase 1, Lake County Public Health Agency is the only provider, if you will, that's going to receive vaccine. But in the next phase, both St. Vincent Health, as well as Rocky Mountain Family Practice and Public Health will receive those. So we'll rely on that communication between all the providers and also recognize that there are people that don't go to providers, and we will come up with a way that we can figure those pieces out. So it is a work in progress. It's not going to be perfect. We know that some people will get vaccinated in phase 2 that should have waited to 3 and vice versa. But we will do our best. We'll get folks through. And it'll be important, like I said, when the time comes, we'll be working with, I would recommend for folks that do already have that provider that is where you should receive your vaccine.
Thank you.
There's a question in the chat about hearing some time ago that there might be 2 or more variants of nCoV-2. And does the vaccine account for this eventuality? Yes. What's excellent about all coronaviruses is they have the spike protein. And that's that little spiky thing that we have all seen. And the vaccine is designed to recognize that spike protein. So as long as the infecting agent has a spike protein, which honestly is every coronavirus, including just the common cold coronavirus, this vaccine will work against any variant of that infection.
Well, that leads me to another question. Then will COVID-19 vaccine work against common cold or flu?
In theory, yes. So not flu, right? Influenza is a different virus. But for the common cold virus, any virus that's a coronavirus, yes, this vaccine should have activity against that as well. So who knows? Maybe we have found the cure for the common cold. I always said that I would be swinging from a hammock in Tahiti when that happened. So maybe this is my cue.
We've got some questions in the chat. Can you see them, Lisa?
Yeah. So who decided which vaccine we received, Pfizer or Moderna? That decision was made for us. We don't have the ultra cold freezer device, as does most of rural America. So Colleen decided very smartly that we were going to be first in line for the Moderna vaccine because that is a vaccine that is easily stored, and we already have the facilities for that one. The next question also, what is the correct language to use when discussing vaccines? For example, that they improve health outcomes but cannot provide a guaranteed for immunity. Is that correct to say? Yes, that is the correct language to use, that vaccines absolutely improve health outcomes, but no vaccine can guarantee 100% immunity. The cost.
Lisa, there's a question regarding cost. So the question is, some of the families in the community are curious what the cost will be for the vaccine.
So the vaccine is free to everyone, both doses, no matter what provider you go to.
Is that because the United States government is picking up the cost of the vaccine?
Yes,
Okay.
is my best answer. Because on the normal day-to-day, there's always some supplemental funding to provide vaccines for free because of the recognition of that health outcome piece. To not have any barriers in place when it comes to vaccines. That's universal. There's funding like vaccines for children and this other funding source. So that's pretty universal in the vaccine world.
And can you address the dosage schedule again?
So it will be 2 doses. And with Moderna, what we're being told is that it's 28 days apart.
My question is, so let's say if we got our shot, we got the first shot of Moderna, and then 28 days later, for some reason, we didn't get enough in Colorado to have enough to vaccinate people that got it 28 days, prior. Is that going to be, I guess my question is, how long, is there more time though that, like, I don't even know how to phrase it, but.
No, I think I understand what you're saying. So with any vaccine, if you take it too soon, it's not effective. If you take it 28 days and any time past it, it is truly considered, we'll use that word booster, if you will. I think that supply question is an unknown at this point in time, and I appreciate that. But what we're being told is that once every, manufacturer gets to go ahead, that flow is going to open up pretty quickly. So for example, with Pfizer, and I'm going to butcher the number, and Kaylee might jump in and put in the actual number. Just for an example, the amount of Pfizer vaccine was like 46,900 doses. I think that's close. And then for Moderna, it's double of what's coming into Colorado on that first shipment. So it's 96 something. Thank you, Kaylee. I got the head nod.
And Colleen, just to clarify too, as you said, if you get it 28 days or after that, your first dose is not ineffective, correct?
Right. No, exactly.
Okay.
That's exactly right. Thank you, Sarah. So yes, 20 days and any time after 20 days is okay.
And then Ms. Cannon, to follow up with that, I think also maybe what you're asking is how effective is only 1 dose of the vaccine? And so probably about 50% efficacy. And so if you look at the initial data that came out of the phase 3 trials from the Moderna vaccine, the curve flattened. And so although the people who did not get the vaccine, they got the placebo, continued to be infected with COVID, there was only, there were no serious forms of COVID in the vaccinated group. So even 1 dose is efficacious for sure, obviously much better than nothing, but the maximum efficacy is after 2 doses. And obviously we want to make sure that everybody is maximally protected.
Thank you.
Hey, I got a question. What phase will folks who are taking care of elderly relatives fall into? Otherwise, less than 65 and healthy individuals who are taking care of elderly relatives?
That's a great question. That hasn't actually been teased out, and that might just be a case-by-case conversation around that. Obviously, the person that you're caring for and or whoever that is I'm talking about, would be eligible for that vaccine first, and then we could have a conversation if we do feel that there's some, home providers that we recognize.
Gotcha. Thanks for that.
Hi there. A question that I've received recently is if a person's medical provider is out of Lake County and they're considered a high-risk patient and they're being told, talk to your medical provider about when you'll be eligible to receive the vaccine, because they live in Lake County and the medical provider is out of Lake County, has CDPHE kind of determined which county then the vaccine should be given in? Does it get given in your home county, or do you go out of county to your medical provider to seek that?
I think that's another great question. And it really is, if they have the opportunity to use their own medical provider, that is best, just because of that continuity of care piece that we talk about in healthcare and having a medical home. but obviously if there's an issue, then we'll make it happen. So for example, we know that we have some health workers that work in multiple counties. They might get vaccinated in a different county, even though they live here and work here in our hospital system as well. It's really going to be when we get it, who's available and how it rolls out in that respect. And obviously, as we know, if there's complications, then we will have that ability to have some of those conversations with some of those folks.
Colleen, a related question. I'm curious if you would consider CMC students as being in county or if they need to go to their provider elsewhere.
Nope. So CMC is already identified as a congregate setting. So, right, that means that folks are living together in close quarters, don't have the ability to separate. So we do have you as one of our settings that we would be interested in vaccinating. Because it's about community, it's about who's physically here doing those things. We're not obviously going to have folks that coming in from out of state. I want to make sure that we're taking care of them so they don't have the ability to spread anything. So decrease the spread. Let's get out of this thing.
Colleen, we have a question on tiers. So if there's someone who stays in phase 1, declines the vaccine, how does that affect the next tier?
So basically so right now as it works with phase 1, depending on the supply, we've already set up established times that we're looking to vaccinate our phase 1 folks. And once we get past that timeline, and it really will depend on supply, then we will not hesitate to move on. And then obviously if that person needs to be vaccinated, because we are working one-on-one with our healthcare providers and, to ensure that those folks are vaccinated, we'll figure that out with them. But we will not wait, like we are not sitting on doses, if that makes sense.
Colleen, this is Sarah Mudge. I just want to be sure to as Dr. Lisa said, and this is all really great and hopeful news, but as we get vaccinated, I don't imagine that our protocols will immediately disappear. And even those who are vaccinated should be wearing masks because that would cause a lot of confusion in the community, I would think. And so we kind of, as we have phases that we fall in based on our data, I think that none of our social distancing or precautionary protocols would be reduced just because the vaccine is starting to get administered. And I suppose we'd work into kind of a ratcheting down plan on those and into green if we were successful.
Yes, I can appreciate that, Sarah. Exactly. Like, this does not take away any of the precautions that we're currently using. We really cannot think about not having all these precautions in place until we feel confident that there's herd immunity, and that more than likely isn't going to happen until summertime. So it's important, just to the question earlier, right? It's about the health outcome, no guarantee of immunity, nothing's 100%. It's important to have all of these layers continue to be in protection. And if we do see a decrease in cases, and to your point, and if we have the ability to start, opening back our community, it still does not change in any of those phases on the dial, which we can talk about the dial here next if we're coming out of vaccine questions, that all of those precautions remain in place.
But it is very important to remember, again, that once we achieve herd immunity, once we have a 70% vaccination rate in our communities, that those numbers will go down, the dial will naturally follow, and then the pandemic will be over. So if I have to say it 100 times, we have to be vaccinated to make that happen. So there is a light at the end of the tunnel. This will not go on for years and years and years if we all get vaccinated. So I'll say that 100 more times before the meeting is over.
Question, is there a timeline for children to receive the vaccine?
So Moderna this week started their adolescent clinical trials. If we looked at the timeline on how this was approved for adults, it was about 3 to 4 months in order to gather enough information to determine efficacy and safety in the adult population. And so it's adolescents, and so that would be the next step of vaccinations are people 13 to 18. The Pfizer vaccine has been shown to be safe and efficacious in people older than 16, but that data is not nearly as strong as the over 18 data, but it's coming, and I'm hopeful that by summer there will be safety and efficacy data for adolescents, and then the next phase, of course, would be younger children.
When the vaccine is ready, how will people be notified? Will there be a protocol, such as dispensed by alphabetical order, age, etc.? And will the vaccine be an annual vaccine?
So I can start with the first one. So when the phase, if you're eligible in that phase, like we will continue to push messaging out. We did just put in the chat, the timeline and status will be updated on our Lake County OEM page. For the second phase, the reason we're trying to use providers as much as possible who already have established relationships, that's important. So it wouldn't necessarily be alphabetical, age. And once it's open to the general public, it would be availability of doses, timing of clinics, and things like that. So there won't be anything where there's a list. And in phase 2, public health's goal is truly to go out into these areas and into these populations specifically that we've already identified. Like, for example, CMC would fall into that. So we would be doing a lot of what we call like a closed point of dispensing where it's not open for the public. We're doing very specific targeted, groups, if you will, that fall into that phase 2 so that we ensure that we are getting the right folks vaccinated.
And then will it be an annual vaccine? We don't know.
Oh, yeah.
Sorry. Yeah, we don't know. The only way that we're going to be able to know that is to look what happens next fall. And if antibody titers remain adequate for those of us who have been vaccinated, then no, it won't have to be an annual vaccination. If, however, the antibody titers are not adequate, then there might be. Again, the great thing about these, at least the Pfizer vaccine and the Moderna vaccine, is that it's a universal vaccine for coronaviruses, because by definition they have the corona, they have their spike proteins, and this vaccine was designed to recognize those. And so it's possible that one vaccine will be it, but we just don't know. So we have to be patient and wait and see what the data shows us next summer.
And this is Karen. To answer the question about PR and marketing, a lot of what you're seeing happening here tonight will be ongoing, talking to people with the different phases. Lisa's calling it her dog and pony show to get out there and do this type of presentation with anybody. So if you have civic groups or church groups or whatever that you know of that would like Lisa to do a Zoom meeting, present facts, answer questions, or call with Colleen or any combination of people. We're also, one thing we've learned since March is how great we work together on figuring out all of this messaging and getting it out there. Sometimes we're waiting for the state of Colorado because we don't want to put things out that are incorrect, and we want to really communicate, I want to say succinctly. So with all the messaging that's going out there, we have very clear messaging from the state, and that's what we're going to be using, but will be lots of us in partnership getting it out there.
Thanks, everyone. Do we have any other questions regarding the vaccine, or should we move on to an update regarding the dial and mitigation plan? All right, well, feel free to add in the other questions that occur to you. But in interest of time, Colleen, do you want to update us on the dial?
Yes. So we are currently still in orange on the dial. even though our metrics, the way they measure our cases and like positivity rate and incident rate has been in red, we have been working with CDPHE, so Colorado Department, Public Health and Environment, that has allowed us to remain in orange while we look at other measures that might be effective, that might be in that red dial phase. So we did update our public health order that went into effect today. And the change that we had met on Monday, we being community members, BOCC, and the mayor, to talk about what we felt was one of the things that we can do that falls into that red category. And the decision was made to not allow inside events. What we are finding is where we are seeing cases is when 2 or more households get together, interact inside, no masks, no precautions, and continue to spread it. So when you think of an indoor event, that means that it's usually more than 2 households, greater than 6 people, which would be already against our orange parameters, but really wanted to recognize the fact that we understand that we're coming into the holiday season. And we also understand that if everyone gets together and forgets all these precautions, we have a lot more cases and darker days ahead of us than lighter days once this vaccine has gotten out to more of our community members. So that is where we're at. We will continue the conversation with CDPHE. Our goal is truly to keep our businesses open as effectively as we can. We ask that folks honor the social distancing, the group sizes, and not push our businesses in the sense of, coming in with 15 people, like that is not acceptable in this time. So let's honor them, honor yourselves, honor our community, and stick to that no more than 2 households, 6 people getting together. And even then from the state level, the preference is 1 household. Think about it. If we do this for Christmas, this might be the last time that I am coming on as a public health official to say, please don't get together. Like this might be the last ultimate sacrifice that we have to make in order to have all the other holidays coming up to be able to gather versus, hey, midsummer, we're still here. Guess what? No 4th of July, right? And so I recognize how important the holidays are coming up, but I also recognize the importance of human life and preserving it and making sure that we decrease our cases and not pass it on, unknowingly, which happens a lot, as well as, not intentionally harming anyone. So that is what I'll say about the dial and kind of my soapbox, obviously. And so there is, I just got a little message that reminded me. The state is talking about what they are calling a 5-star business certification program. This 5-star program would allow businesses to operate in a less restrictive manner on the dial. For example, if we're in orange and we have certified businesses, they might be able to operate in yellow restrictions. It's a very intensive, complicated process right now as it's been laid out from the state. We are looking at what we can do here locally that is not necessarily a 5-star, but we feel like the intent of the 5-star is truly to ensure that businesses are operating as safely as possible, keeping themselves safe and their employees safe, as well as their customers safe. We did a self-certification program when we started to reopen. Public health is looking at ways that we can kind of ensure that folks understand kind of the parameters and support them to do this as best as possible. And the reality for a 5-star probably wouldn't be something that would be up and running to February, if not later. What I really would like to see is instead of trying to step through and have less restrictions in the sense of, through this program, I would like to see our community decrease our spread and just move naturally through this dial process and have less restriction because we have less cases. And so I think that's all I'll say about the 5-star at this
Colleen,
point.
this is
Yes.
Greg. I'd like to speak to that. I think that between County Health, you, and the county commissioners, there's been a strong attempt to keep our businesses open in the midst of red. So I appreciate that, but I think all the business people should also understand that they have to take this very seriously.
Yep. Thank you,
Greg.
Mayor. And thank you, Colleen. Also, if I could add, the whole county, it's my understanding, correct me if I'm wrong, Colleen, but the whole county would have to show a reduction in cases for 2 or more weeks to be eligible. And what we heard from the state just the other day was that only one county in the entire state would even be eligible for such a program. And I would like to just reiterate, you know, I would echo what the mayor says is, you know, we've been doing what we can, but we certainly don't want to do anything to harm our progress. And I agree wholeheartedly with you, Colleen, that we need to continue to move that way naturally. And I think we've done a great job in doing what we can to meet that intent.
Yes, and I think too, you know, we want to figure out a way that we can recognize, you know, those businesses. So we are looking at other models that are happening in other counties currently, and stay tuned for that, because we really do want to honor so many of our businesses are doing this so well. And then we also recognize that we have, you know, an influx of visitors, and we want to show them how to come into our spaces safely.
I have a quick question just to clarify. Reading the email that came out today, the prohibiting indoor events, that does not apply to businesses? That is strictly for social gatherings outside of businesses?
No, that applies to businesses. I'm not aware of anyone holding an event. So an event means to me that you're mixing households, you know, in a space where you've set up saying, hey, we're having a Christmas party in our space, and that is not allowed at this point in time.
But okay, so that's the definition of an event. It's not an event being that we're open this evening.
Right.
Okay. That's the clarification I was
Okay, good.
trying to drive to. Thank you very
That was
much.
good. I'm glad that one came up good.
Yeah.
And Colleen and Jack, to Jack's point, for instance, the city of Leadville has canceled all of our Christmas parties. I hate to do that, but we have to hunker down for the next 3 or 4 months and make sure we get through this. So we are canceling our parties, per se.
Yeah, absolutely.
So it looks like I'm not always great at looking at the chat. And so I did just glance over, and I do see that there's a question about the school district. And from my understanding, starting in January, they will continue in that hybrid model. Obviously, we have pretty regular contact with the school district. We check in, we kind of inform them where we're at, cases, things like that. And then they make a decision based on that. So as you know, it's ever changing, and we never know exactly, you know, what's happening. And so at this point in time, the information I have is that they will continue in yellow. It does bring up a point that I also would like to point out for kind of what we have going on currently. It is so exciting that we have rapid testing happening in our community at both St. Vincent Health and Rocky Mountain Family Practice. What's challenging is people get a result right away. We're not, as public health, are always aware of that until 2 days later. As you can imagine, it has to get entered into a system. The system has to pick up that information. We get that information from another system. And so do not wait for public health to call you. You know what to do. If you are sick, stay home. If you have a positive case, if you're positive, your provider will tell you you need to isolate. They will also tell you that your family and close contacts need to quarantine, that they should not be out in the public as well. If you receive a statement from the school saying your child's school or class cohort is out on quarantine, that is your quarantine. Do not wait for public health at that point in time. Feel free to call us for clarifications, but what we're finding is that people are waiting for us to call them, and they continue to circulate throughout the community when they already know that they should be isolating and quarantining, but they haven't heard from us. Please be your own, be responsible, and do not necessarily wait for us. Like I said, the systems behind the scenes are not perfect. When you find out that rapid test result, you and that provider are the two who know. I will not know probably for at least 2 days. Feel free to call us, but our providers know that information. And then what happens too is sometimes, you know what, you get quarantined back to back. So you might think you have quarantine for 7 days, but it actually might be for 14 or 21. So then that is when public health will step in and have those conversations about why that might be extended. So I totally appreciate everything that everyone's doing, but please recognize that do not wait for a phone call from public health, and or if you leave a message with us, please know that our response is delayed. We continue to have double-digit days of cases, and we are still on top of it as far as being able for 100% of our positive cases, we're still contact tracing. So we're calling that case, we're having conversations, and we're finding out, you know, information about folks. The best person to let you know that you might be a close contact is a person who is positive versus public health. That's what I'll say about that one. Thank you. Let me see. And I think the other big, sorry, I feel like I'm a little bit all over the board, but I think the other big piece, and when we think about celebrations and Christmas parties, and you know, that we have to sacrifice this year in a really great way to know that we can do things sooner and get together sooner, is we also recognize this is a very spiritual time for a lot of folks. There are different things happening at houses of worship, you know, during this time. We ask that right now there are no capacity limits on places of worship. We ask that if you participate in places like that, that you continue to follow those sitting with your household 6 feet apart from other households, masks on the whole entire time. Believe it or not, you can sing through a mask. You do not need to take off your mask when you sing. We recognize that when people sing and their mask is down, you actually push out your breath further. So 6 feet is not enough. So please think about that, pass that message on, and figure out other creative ways. Maybe there's opportunity to work with, you know, your place of worship to say, hey, we think there's a safer way to do it, and really help educate each other. I think that's the biggest piece is, you know, helping each other. And because we have such high cases currently at any given time right now, we're monitoring 50 people who have active cases in our community. So this is not uncommon that you might run into 10 people and you might unknowingly run into someone that has COVID. So when I think about places of worship that now don't have a capacity, please be mindful of how you gather, when you gather, and let's do it safely.
There is a link in regarding testing options. St. Vincent has compiled sort of a comprehensive update there, so check that out. And Kaylee, I think I stepped on you there, sorry.
No, it's okay. I just wanted to take a quick minute since we're getting a lot of questions this week. If you're in the county and you're receiving an emergency alert or message, that is from us. It's called a wireless emergency alert, so it's called a WEA, and it's through a program through FEMA and Homeland Security. So we send those every Saturday. That alert is active for 8 hours between noon and 8 p.m. And we understand if it is annoying for residents, we're just trying to remind everyone to take the COVID precautions seriously, but also to remind you all that those messages hit all visitor cell phones that connect to a cell phone tower in Lake County. So if we have, you know, a couple of thousand people driving it through Leadville, Lake County on Saturdays, that message is hitting their phones as long as it's enabled. So that's another mitigation measure we're taking. And as long as we're in orange or potentially stricter, we will continue to send those. But if you have any questions or have any issues, let me know. Thanks.
Thanks, Colleen. Thanks, Dr. Lisa. Thanks, Kaylee. Are there any other questions that you would like to address this evening while we're together?
You know what, this is Jack. I have one question that has come to my attention a couple times from customers, and I'm not really sure how to respond to it other than I've tried, but and it's sort of a weird question, but people come in and we ask them to put their mask on, and they put their mask on. And I've had twice I've been asked, if I can smell smoke through my mask, then I'm surely able to catch coronavirus through my mask. So, you know, why am I doing it? I've said, oh, it's the Brownian motion that helps with masks and smaller particles, but I'm not sure that falls on anyone's other ears unless they've ever read about that. So what's a simple answer I can tell people?
I can answer that.
Yeah.
Yeah. So it's droplet. And so when you smell an odor, you know, you have to remember the particles are very small, and they're not trapped in droplets.
Yeah.
They're just, you know, they're aerosolized in the air. When you're speaking, when you're coughing, when you're singing, that kind of stuff, the virus is extruded from your body in droplets. And so the droplets are big enough to get caught in the mask.
Perfect. Yeah, great. Because yeah, I'm like, okay, yeah, because of course they bring up the measurements. They're going, oh, well, these are 0.4 microns versus a coronavirus at 0.03 microns, and I'm like, you know, I don't know. I'm not a scientist on this one, but yeah, okay, that sounds good. Thank you. I was just curious on that.
And Jack, there's a really good comic, and I don't mean to be offensive, but basically if you know, wet your pants with your pants on, it kind of just stays in your pants. But if you don't have your pants on and you end up wetting yourself, it gets in a lot more places. So wear your pants and wear your mask. I
like that one. Actually, that's, yeah, they're very good. Thank you.
I think that's a good visual for people.
Yeah, I know it, right, exactly.
And you can make it as
yeah, you can have some fun with it, but yeah, that's a good way to approach it. Yeah, very good. Hey, and thank you for doing this conference. I mean, these are good, and I do appreciate it. I really do. So thanks for all your team's efforts.
Yes, thank you. And it is a team. I think that's important to recognize that, you know, not everyone is actually present on this call who continues to do so much behind the scenes, as well as even now we have Yudelia Contreras from Lake County Build a Generation, who is translating for us to ensure that we reach our whole community. So for those of you who are English speaking, you're not going to hear that piece of the puzzle, but thank you, Yudelia, for doing that.
All right, well, it is 7. Pretty impressive that you guys landed right on the hour. So I'll just say last call for any questions or comments. And just to remind all, we will post the videos later this evening. And please spread the word to your friends, families, colleagues, make sure that they're informed and aware. And also to reiterate what Karen shared, you know, if there's opportunity to come to groups and do a customized education, please let us know, because we want to make sure that we're able to get in front of folks who have the questions and have them receive the information that's going to have them make a comfortable, informed decision to be vaccinated when that's available to them.
Yes, thank you again, and have a great, safe holiday. And we are continuing working behind the scenes for you to keep us as safe as possible. And we hope you do the same. Thank you.
Thank you.